According to the American Academy of Implant Dentistry, more than 30 million Americans are missing all their teeth in one or both arches and 15 million have crown and bridge replacements for missing teeth. It is estimated that 3 million people have at least one implant, and that number grows by an average of 500,000 each year. The capability to replace missing teeth with dental implants has reached a level of predictability, with long-term success rates of over 90%. Implant success is multifaceted, beginning with a hierarchy of steps that include evidence-based treatment planning, precise surgical execution, and a prosthetic replacement that is aesthetically pleasing. Integral to the success of implants is the architecture and health of the soft tissue. Here are a few steps into a dental implant's treatment process. Step I. Choosing the prosthesis. You may think discussing the medical and dental history is the first step. However, a good way to get to know the patient is by having a discussion about what they see as the final outcome. What do they want to see when they look in the mirror and smile? That starts with a discussion about the final prosthesis and involves educating the patient about the options appropriate for their particular situation and listening to the patient about their needs, values, and expectations. Educating the patient may include demonstration models, diagrams, photos of previous cases, and/or animations of various final implant prosthetics. Computer-based education programs are available that clearly describe and show options for the patient. The available alternatives, non-implant options, should also be discussed. It is the dentist's role to educate patients so they can make an informed decision based on their personal needs and values. Step 2. Evaluating health history and clinical assessment. Health history. This includes a medical history, dental charting, a complete periodontal examination, documentation of tissue architecture, and assessment of the lip support, smile line, dental musculature, TMJ, and bite relationship. The patient's medical history helps determine if the patient is a suitable candidate for dental implant surgery. Contraindications to implant surgery include any uncontrollable systemic disease, pregnancy, uncontrolled psychological disorders, or uncontrolled drug or alcohol use. Considerations to implant surgery include smoking status, surgeries to the head and neck, radiation therapy or other cancer treatments, patient's age and nutritional status, and diseases of the salivary glands. Significant medical findings may require a consultation and subsequent medical clearance from the patient's physician. The patient interview can offer abundant information regarding the patient's medical history that is not always evident in the history form. Step 3. Obtaining images for diagnosis and treatment. Radiographic analysis and diagnosis for implant placement can be obtained using periapical, panoramic, and cephalometric radiographs, and/or computerized tomography. Computerized tomography use is increasing and offers multiple three-dimensional views that correlate with correct implant size and positioning, size. A panoramic X-ray is useful to gauge patient eligibility, but additional images are needed if treatment is accepted. Computerized tomography produces reconstructed radiological slices called voxels. A cone beam CT has a source that is designed to target the head and neck. The CBCT produce digital image communication in medicine data. The CBCT information is analyzed through software programs, which read the DICOM data and produce an image with 4 different views of the jaw: a cross-sectional view, axial view, panoramic view, and 3D view. As the views are manipulated in the software program, all views are correlated together, in real time. Step 4. Implant and abutment design considerations. The design of the implant body and abutment is a treatment planning choice by the dentist that can have ramifications on implant success. There are many companies worldwide that provide implant fixtures varying in design and material. Titanium implant fixtures have achieved a high success rate over the years due to improvements in thread designs, abutment connections, and a better understanding of bone science. For the purposes of this article, the design choices of the crestal bone area of a dental implant will be addressed. Step 5. Surgical strategies at implant placement. There are techniques that improve soft tissue health during implant placement and recovery. The first step is to decide if the implant will be placed as a 1- or 2-stage procedure. The benefits of a one-stage procedure are, no need for a second recovery surgery, earlier emergence profile formation with healing cap or provisional, shorter treatment time, and occasionally the immediate placement of the provisional tooth at the time of surgery. A two-stage approach is when the implant is placed under the tissue for a healing period. This is indicated when bone density is soft and will not support good initial implant stability at placement. A removable provisional prosthesis will put undue stress on the dental implant when the substantial bone is needed to be grafted, or when simultaneous soft tissue grafting is needed to create an improved soft tissue architecture. For more on dentistry implants treatment process, visit our website by clicking the link below the video.